The following portion of Studio 512 is sponsored by Austin Diagnostic Clinic. A condition like diabetes can affect more than just your blood sugar. Dr. Danny Roman, a surgical podiatrist with Austin Diagnostic Clinic, is here to talk about other symptoms that might occur and when to seek medical help. Dr. Roman, what are the primary risks associated with diabetic foot complications?
That's a great question. So, as a diabetic, you can experience a whole host of risks that are associated with the foot and the ankle. Burning, numbness, and tingling, also known as neuropathy, is a progressive condition in which the numbness tends to start at the tips of the toes and sort of work its way up the lower legs. Now, as a diabetic, if you're experiencing neuropathy, you are at risk for other issues. For example, often my patients will come to me and say, I can't feel the ground. And as a consequence of that, they might develop balance disorders and even end up tripping or falling or having a more significant injury.
Wow. And so that's why it's so important, especially if you know you have diabetes or you're starting to notice sores on the feet, that sort of thing, that you do see a doctor immediately, right?
Truly. And also, joint health can suffer as a consequence of diabetes. The small nerves in our feet sort of give feedback to the bones in our lower extremities. And when those bones are not getting the proper feedback as a neuropathic patient, it can lead to sort of destruction of the joint and even advanced arthritis.
Dr. Roman, how does diabetes affect circulation and nerve function in feet?
Sure. So as a diabetic, one experiences elevated blood sugar levels. And when blood sugar levels are elevated for an extended period of time, they often develop what are called glycosylation products. And glycosylation products are basically sugars that wind up getting deposited in the walls of the arteries.
What signs should someone look for that indicate foot issues, and when should they seek medical attention?
Truly, it's a great question. So, burning, numbness, and tingling to the tips of the toes or the bottom of the foot, that's a reason for concern. Also, the way I describe this to my patients regarding circulation, it's sort of like trees in the forest. If there's not enough rainfall to support trees, they don't grow. Equally so, if there's not enough blood flow to the foot, you can't support things like hair growth. So if you have particularly cold feet, or if you notice that the hair stops growing in your lower extremity, that's a reason to also make an appointment.
Sounds good to me. We appreciate your expertise, Dr. Roman. Thank you.
Thank you so much.
Austin Diagnostic Clinic has 19 locations around the Austin area. To find the one nearest to you, go to adclinic.com. The preceding portion of Studio 512 is sponsored by Austin Diagnostic Clinic.